Thanks for joining us again on Housing Health. On Housing TV Africa, your favorite station, a show where we discuss health related issues in our homes or houses. I am your lovely host, Confidence Ruben. Today, we'll be discussing a vital topic that says housing insecurity and its effects on health and development. Before we delve straight into the topic, let's give you an insight or a hint on what the topic entails. Housing insecurity is a condition that includes unaffordable housing, frequent moves, overcrowding, and the risk of eviction or homelessness has profound implications for both individual and community well-being. Research consistently shows that unstable housing is closely linked to poor physical and mental health outcomes. Individuals facing housing insecurity are more likely to suffer from chronic illnesses, experience elevated stress and anxiety, and face barriers to accessing consistent health care. Now, addressing housing as a social determinant of health is essential to fostering healthy, stable communities. Effective interventions, including affordable housing policies, eviction prevention programs, and integrated health care and housing services, are critical to mitigating the long term consequences of housing insecurity. Our guest will be joining us in the studio shortly after this break to analyze what are these housing insecurity effects and its implications on our health and development. Stay tuned, we'll be right back.
Get credible and authentic housing news at your fingertips by downloading the Housing TV mobile app. You can also join the African International Housing Show live from across the globe through the Housing TV mobile app. The mobile app features live streaming and trending housing news. You can locate the AIHS venue via the app, network with AIHS seasoned speakers, and live chat with exhibitors. You can also order house or building materials at AIHS via this app. Download the Housing TV mobile app now from the App Store and Google Play Store. And don't forget to click on the notification button. Available for both iOS and Android users. Housing TV is also on Star Times, channel 149 decoder.
Welcome back, esteemed viewers. If you just joined us, well, the show just started. You haven't missed anything. Like I said earlier on, this is Housing Health on your favorite station, Housing TV Africa, reaching you from the nation's capital, Abuja. I'm still your lovely host, Confidence Ruben. Earlier on, I said we'll be discussing a vital topic that has to do with our environment, which says housing insecurity and its effect on health and development. With me in the studio is our amiable guest who will be doing justice to this topic, analyzing it, telling us what is needed in order to avoid housing insecurity and also knowing more about the impact of housing insecurity on our health as well as our development. She goes by the name Honorable Rosemary Ojochenemi Oshikoya. She is the founder of Ladi Memorial Foundation. Hello, ma'am.
Good evening, our amiable and beautiful host. Thank you again for having me here.
You're welcome. It's good to have you on the show again.
Thank you very much. And thank you for this very everyday topic you're talking about, one which we sometimes shy away from
Exactly.
for many reasons.
Yeah.
It's either we want to be politically correct or we just want to deny the obvious around us, even when we live with the consequences every
That's
day.
true.
Thank you for putting this together.
You're welcome. All right, so let's start. How does housing insecurity impact our access to health care services?
Wow. The Sustainable Development Goal, you remember, sometimes ago. First, we call it the Millennium Goal.
Seven SDG goals.
Because, we started with Millennium Development Goals.
Okay.
And then it's a good topic to start asking ourselves. And, the entire world came together and set milestone standards. We want everybody to have a house. And interestingly, just to answer you, I was at the Habitat 3 in Quito. And that was, I think, sometime in 2017 or so. Then I was a commissioner for environment. So we were there in Quito to do the that. And it is interesting to see how globally housing is an issue for everybody.
Of course it
And
is.
I think at that time, issues of the environment were at the forefront. And the idea of making sure that everybody has sustainable housing. And Nigeria is one of the signatories to this convention. So it's important to underscore that at the beginning, that across the world, the whole world has been talking about their achievements of the Sustainable Development Goal. 2030 is here. If you agree with me, we're just less than 4 years away, less than 5 years away from 2030.
That's true.
So these issues is access to good housing. And if you look around us, you also see, not recently, it was making international news that just not far from us in Niger State, there were these houses that were affected by flooding. And what concerns me, to answer your question, is what are the qualities of houses that were eroded by the rain? And so you find that the houses were basically brick houses, mud houses, a lot of them. And I know, like, speaking of Kogi State, as the then Commissioner for Environment, we went around, and every year, annually, you hear that the structures that are set up around those places where they are set up, and a lot of it were bad. The 2012 flood was also a high there. So what are the challenges we have with good housing? You would find that that seemed to be that a lot of us still need to go back again to look at what even constitutes a good house. A house that is stable, a house that the materials are environmental friendly, that is the trend now, the one that is durable and can protect you. Because the problem with most houses now would be that either the materials you use in the construction of the houses are bad, and then you begin to talk about all the attendance issues that come up with
trying to manage
all
the
that.
materials.
Exactly. And sometimes, again, I would like to talk from the angle of skills. You will find that the technology we actually need to build the house, the technical know-how, the functional skills for us to be evolving, because across the world, you're talking about houses that are adaptable and houses that are meeting certain standards. Sort of, number one, you say they want to be eco-friendly. You're saying that they shouldn't have toxic materials and a whole lot of all that. But we have to also deal with the issues of open spaces and planned settlements. So what if I have a duplex that is sitting in a slum area or is sitting in a waterway? So we are still going to talk about access issues along all these lines and what they are.
Talking about affordable housing, you agree with me that so many people kind of, try to pitch a tent or erect their building in lands or areas they can easily afford. Now, they don't make inquiries about if that environment is, it's okay to erect a building as long as it's affordable, as long as it's cheap. They don't care. What do you have to say about that?
From the conversations on Habitat 3, I'm happy that Habitat 3 is still the last one, where the whole world gathered in environment to discuss these issues. The issues of how planned a community is, and it takes us back to governments, because governments have authority to decide on land use. You set apart certain lands, and you say they are for those purposes. And in planning those lands, you also allocate the basic amenities you want to see around there. So you provide for road networks, which is also a measure of how modern a country is or how developed a country is. Some of those indicators first start, because every time we talk infrastructure, it takes us back again to the domain of what are our laws. In Nigeria, sometimes the laws are not the issue. The enforcement of the laws are the issue. So when you begin to find urban slum areas, and a lot of them, sadly, even when you look into Abuja, when you compare Abuja to a lot of other countries, you will find that over the years, thank God for currently in Abuja, you begin to see that the roads that passes through most of the area councils, they seem to be wearing a new face, the road network. So in terms of infrastructure, you will say it's getting better. In terms of the public places, again, the parks you have, the social spaces you have around there, that's also, because when you're talking about access issues to good houses, you're talking of issues that bring anxiety, issues that bring stress and strain. You're talking about transport convenience, and all of this again are tied down to infrastructure. So now, if within the urban area, because the whole, from mathematics, you will say the whole is made up of the sum of its parts. If you have divided the whole of the, let's say, FCT land, the area council, and you have apportioned that this quality of houses go here, this is the road network, this is the plan, and that. I think with the birth of new estates, a bit of that is managed. But there's still need for us to go back to the ancestral lands, the ceremonial lands, where you have those slum areas, because the minimum standards of what constitutes a good house, not until a community shows up in the news and we carry targeted intervention in that community. But those minimal standards is what globally every country is trying to say, let's phase out certain type of houses, let's phase out certain types of community. Because again, when you're talking of the issues of social vices like rape, like insecurity, like drug abuse, some of these are also made possible. Because, for instance, how would a girl not get sexually abused if she has to live in congested settlements where that doesn't even have privacy? And then at the end of the day, she becomes victim. So those are the issues. It takes us back, like we said, again to the plan. Because sometimes it appears as if in many of the major cities in Nigeria, there are certain areas of blind spots where you can go and start a building and finish till the end, and then the transactions happen either within the area council or some lands in quotes that are not within the control of government. And then those are, so I think it is both a social issue and then it is also a very important challenge that government needs to look at, that every part of Nigeria, in every, and it's also good to state that the autonomy of the local government areas, and because every local government area, that's why I say it's not the law. You would find that within every local government area, there's somebody designated who gives land approval. But how does he give this approval where every area is not planned? But I love a particular good example I saw in Kaduna State. You will find that I think some time ago, the land that belongs to Kaduna Polytechnic and the community was excised, and I think they call it Baggy Villa. But one of the first things the local community did was to get a plan. And then the whole area was mapped out into clear, distinct plots where your backyard is not facing my toilet, you know, your front is not facing my toilet, like, you know, the kind of the unplanned communities we are talking about. But it impressed me that in that particular case, the local community, where I think around that Sabo television axis, were able to carry this new piece of land and demarcate them into proper plots. And I think that it's not to say that everyone else is actually involved in this one. So if there are still problems, which is true, Nigeria seem not to have the record. If you check on the websites now, if you check on the Nigerian portal, or you check the portal of UNDP and the rest of them, and you see where states report in terms of the infrastructure, in terms of the housing and all of that, sometimes you find that this data, now I'm talking as an NGO person, you'll find that these data are very absent for Nigeria in most of this utility, infrastructure, and critical issues we are talking about. So I think we need to go back to that level of accountability, which I'm happy the government of today has also put on the table, that we now need to be able to say in 2023, 2024, 2025, and speaking of this year, this is where we are. And so if the accountability responsible officer at every land office, at every level is required to say, this is how we have progressed within this period to this period, I think it will inspire more public confidence and accountability that we can tell. But I doubt today that you're able to tell this is the total number of unplanned houses, this is the total number of unplanned communities. I haven't been able to lay hand on that document.
But at least to an extent, we will say the federal, the FCT minister, Yesoviko, is really trying.
The road infrastructure, yes.
He's really trying. Now, you talked about phasing out the slums. That's in the rural areas. I think before phasing out the slums, the federal government should at least give an alternative to those people. Because you don't just phase out the slums and you leave them like that. I think the minister going here and there, demolishing houses and all that, you need to give the people an alternative. Give them something else to, you know, like another structure or a house for them to stay in before demolition or phasing out their properties.
But I think you need to, when we talk about housing in the FCT, the houses that are being demolished by the FCT minister, so to speak, are not slum houses really. Because some of the ones that are being demolished are well-planned houses and well-built. So I wouldn't think
are also demolished
some of them, but the real issues why they are being demolished, if I read the news correctly, it's not necessarily because they are in slum areas.
Okay.
It's actually because possibly, if I read the news correctly again, it's because those houses are in lands, possibly approval related issues.
Okay.
But you know, again, that is also another very highly contentious issue.
It is.
Because if we are really talking about the slum houses, I also agree with you. Talking from a humanistic point of view, and the fact that there seem to be economic bites everywhere. I used to say this to myself: when you travel across the world, and you are not, even if you are arriving in the thick dark in another country, it always interests me to see how many lights, you know, the number of lights there shows how many houses they were. And one of these, I don't want to call particular countries, so it doesn't appear as if you're doing that level of comparison. But I would also ask you to cast your mind back when you find yourself traveling. Most times you will see the beauty of the countries from what you see in the air. Because before your plane, well, by the time you come down from this, your 10,000 feet, and you are beginning to have a clear view of the city where you are dropping, it always impresses me how you could tell how well planned a country is from the air.
That's true.
And most often, almost on every other airport in Nigeria, you are coming in. I would leave you to answer that question for yourself. How many of this well-planned interface in terms of the real infrastructure we're talking about, the road, you know, electricity, potable water? Because when you're talking of access, the issue of safe water is another part.
That's true.
The water quality and how much, because the truth be told, the impact of this housing thing we are talking about goes into how many, like somebody put it, how many madmen in quotes are walking the streets. Mental health issues, a lot of depression, a lot of reasons why we say that students are not focusing in school. Another area of my concern is the impact of all of this on the child. It would also explain why some of our social vices, as we are saying them here, everybody simply just want to relocate overnight from the village. It's because of these issues we are talking about. So if we're going to holistically, I think the very major important one we are having here is trying to, the government of the day, for instance, is trying to look at the issues of the making the area councils or local government areas, as we call them, very sustainable. But I think one of the major issues we should look into that conversation we are having, especially with the level of autonomy local governments are having now, is to say that the land office within every local government area across Nigeria begin to pay attention to these issues of standardization of the basic house we have. But having said that, a house necessarily don't have to be made of concrete and iron for it to meet the minimum standard of what is good quality housing. So there needs to be a lot of more sensitization within the housing sector. Because what are the options we have now? The price of cement is a lot high when you want to build. So when you look at the cost of how much does it take me to build a house? I remember during the time of Shagari, I was still a child. But then you will find that the concept of low-cost housing, I was born and raised in Kaduna. The concept of low-cost housing seemed to happen a lot. And then you find, but the sad one I saw was somewhere, I think between Badinawa and Narai, low-cost or so, you find that there were so much of these beautiful houses that were built. But yet nobody ever lived in them because they claimed that they were not well built. I'm not sure if anybody get persecuted, but I think that is one of the areas that should concern us. But once upon a time in Nigeria, the concept of low-cost housing, because again, I speak from the point of Kaduna, you will find that there were these simple houses around Badinawa, Narai, low-cost. They called them low-cost then. And the idea was, you look at what is the smallest size you find of a house. Possibly it could be a room self-contained. I think when you look at Nyanya axis here, there's that Nyanya by the police. You see those kind of low-cost houses. But then if you find them, they were simple houses that were built. Now there's this concept one of even using bricks, which are durable and do not require venting and plastering. So I think the housing professionals in Nigeria need to also come out with this affordable cost thing. So that with what you have in mortgage, today, it seems as if the poor in Nigeria really can't access. That has driven up inflation. But everybody wants to own home for security reasons you're talking about, for mental health. You find again for civil servants. But then if you permit me to observe, for those of us in skills and in NGO, renting an office is almost impossible. You're talking of access. So let me speak for my group, the NGO people. You will find at the end of the day that renting, like our office here in Abuja, I'm told annually we pay over 2.5 million.
Wow.
Now you ask me, how much support do you receive as an NGO for all the good charitable good you are doing? But if you see now, if there is this access to affordable housing, good quality housing. And if the places were well planned, then you wouldn't have pushed all NGOs out of Maitama and out of everywhere else, and then you are pushing them to the outskirts. Then it takes us back to the small artisans and the lower rung of the society, those craftspeople. And it's because they cannot access where you call planned and proper and settled. And that again explains why they fall into land scammers.
Even the land, buying the land again is something else. The price
in
is
FCT, it's something else.
It's something else entirely. All right, let's move away from that and talk about the physical health issues that are most commonly linked to unstable or substandard housing. What are these physical health issues related to housing insecurity?
The first thing is, I would like to talk about anxiety.
Okay.
And the man died. And the widow relocated to the village. These have become so everyday thing around us. We get all self-righteous when we talk about some of these issues. But the truth of it all is, we see that frequent relocation creates anxiety. It creates a lot of mental stress on the person. And now, if you talk about mental stress, it takes us to another very area where we have a lot of challenge. Somewhere in some parts of the world, everybody seems to have access to a shrink somewhere.
That's true.
In Nigeria, I am not sure I've ever seen the advertisement of somebody who said, I am a shrink. Please visit me.
No, there's not.
So today, everybody simply go to their religious leaders who necessarily are not trained. No, some of them are actually not trained. They didn't go to do any psychology or any kind of psychiatric thing. And so at the end of the day, we actually have a lot of people who just go mad, who just die, who again get depressed, and the next thing you hear that the person just jump over the bridge. But in addition to that, you see that with these poor housing issues we are talking about, a bit of the health issue takes us back to this domain of abuse.
Of course.
We get all self-righteous and we talk about how many people are into drugs and how many people are into that. As an NGO, I see that a lot. Just a few days ago, a young girl who said she's in the university, 19 years old, sent me a message and said she's pregnant.
Wow.
And she needs help. And I'm telling you that because now, because you run an NGO, the whole world comes to you.
That's true.
And then it makes you sad because you actually don't have the resources to look at a lot at all of this. I went to a slum area in Otako here. I think it was actually constructed at one time as a general hospital. And then it was abandoned. And today it houses over 5,000 human beings. And when we went there, there is no proper security, safety, or privacy in none of that. And it shocked me and it pains me right in the middle of Otako. And then you will find there that it has become a place. But when I look closely at most of the children I saw there, both boys and girls, they were already sexually active. So the domain of drugs, the domain of drug abuse goes again to these are the health consequences we have there. Then, of course, without being told, HIV/AIDS. In a bid to survive, a lot of people get taken advantage of. But do you see again that a lot of injuries happen? Because if the structures are unstable, people would also find themselves getting into one kind of disaster. Look at it again. When you talk about toxic materials, exposure through those kind of environments, most of them sometimes will be close to wastes and all of that. Poor housing issues actually affect a lot of us. Not to talk about the trauma it has in a child. You tell a child tomorrow the child is timid, the child is having low self-confidence, the child is recruited into vices. These are all the health challenges. Some of them are physical, some of them are mental, some of them are also social ones. There's also this issue of stigmatization. But talking about health, when people are relocating very frequently from one place to the other, oftentimes they can't access medical care again. Look at the position of hospitals like the secondary hospitals you have within FCT. They are mostly planned in organized area. When you begin to talk about the domain of the primary healthcare, you would find again that most of them, and sad to say, there was the story, each of us have our own experience with these ones. It takes you to need a specialized healthcare. Then you will find that even our dear Abuja don't have them. I'm sure each of us have our own story to tell, that for some of the specialized care you have. So now if you who live in the urban area and who have access to National Hospital, Garki Hospital, Maitama General Hospital, not to talk of the congestion you find in those hospitals. Sometimes I heard one very strange name, I can't even remember. that you need to do one wonderful test, and you have gone to, I know somebody who had gone to Garki Hospital, who had gone to Metama, and they said they don't run that test. Their machine is bad. They referred this person to go to Gwagwalada, and Gwagwalada said this particular person to run that test has to wait for 3 months. The person is dying, and that test needs to be done. Eventually, they had to carry themselves. This is now the question is, where does this person live within Abuja? Do you have access to transportation?
Exactly.
Which exacerbates your stress again.
Yeah.
How easy is it for you to commute? Because it wouldn't be a bad idea for you to be able to live anywhere in Abuja and anywhere in the area council. If the road network, it takes us back to infrastructure. If the road, not only that the road is good, but that the transport service is accessible. And then it is also dependable. So I think a lot of the pressure, if you ask me, has to do with the mental stress, access to healthcare, your ability to manage your conditions. So if these are close to you, anywhere you are, I think it will not necessarily matter where you live. Using places like London as an example, if I can count on the train coming, or I can count on the bus and all of that within this, and then the planning of those other health facilities. So yes, if you are not sick before, you are likely to become sick if your housing is not good. If ventilation is an issue, you are going to have a whole lot of asthma and a respiratory system related issue. You're going to have a lot of sleep disorder.
And overcrowding is also
exactly like in this slum area I just mentioned, right in the middle of Utaku. A lot of people who work within the central area would elect to stay there because transportation is an issue. I meet a lot of people, particularly craftsmen, carpenters, drivers, and they tell you they can't afford rent, even in Lugbe, and that you have to come all the way from Suleja, you have to come from Jikwe, you have to come from Karu. So I think addressing the issues of affordable, simple housing, exactly, and then arranging that transportation for these people who really can't afford means of mobility will help address a lot of the physical, mental, because come to think of it, what is health? A lot of people think if I don't go to hospital for 10 years, that means I am well. But WHO defines health as the complete state of well-being, which touches on physical, mental, social, psychological, put all of that. Now, if you put that definition on the table and say, are you sure you are healthy?
One or two is missing. One or two is missing. All right, let's go to the aspect of employment and income stability. How does housing insecurity affect adults' employment as well as their income stability?
I just shared with you the case of a driver and a carpenter who I've had to discuss with. And as an NGO, I could also tell you that it was difficult for us to employ competent people. And the reason they give to you, particularly in Abuja, and not just in Abuja, other places where we have that, is basically boils down on the distance of where they live to where they work. And when I asked this carpenter, why do you come from Suleja? Because to leave Suleja and come to Amak, where my office is and where you have to do a job, that day he had to spend 10,000 on transport. He explained how from the corner of Suleja he lives, he takes 2 or 3 vehicles to get to urban center, and he had to do the same. But until, let me ask you, if you need a carpenter to fix something in your house, and 10,000 is transportation, you, everyday person, how much of that can you pay?
No, I can't.
So you see, it answers your question, that employability. And a lot in civil service, even here, you see, you go to certain offices and they tell you people can't come to work every day.
Of course.
So to answer your question, housing matter, your employability, and your capacity to keep your job, they are all related. If you don't solve out your accessibility to work, no employer is able to pay you. Because I'm asking myself, we needed an office assistant. And even people who come to my NGO as volunteer, they will tell you the cost of living. I don't live in town. No. I live in Karujikwe here. And by the time they calculate, for them to come to town, in quotes, central area, they have to spend an average of 60 to 70,000 naira per month.
That's almost more than half of the salary.
Exactly. So they can't get the job.
Of course.
And then in the places where they live, most often than not, you will need to access these services. So, but it's different again. We have to put that in context. Who are you employing and where does the person live and what is the salary of the person? But I think if you ask me, transportation constraint has cut across.
Of course.
But I think, again, to give the credit to government, there are some routes that are better.
Yeah.
Part of them is if you can catch the mass transit bus.
Okay.
Some people said they have to leave their work early, because if the last bus going to Nyanya axis has leave, your Oyo is your name.
Yes.
So I think the Ministry of Transportation would again have to look at, it's good to develop every part of town. It's good to create affordable housing scheme. When that is addressed and people are able to keep a good roof over there, their ability to get employment is a function of their ability to be punctual at work, their ability not to report sick every time due to the issues that can be avoided if they have better housing arrangements and all of that. But if you can't access where you need to work or where your work is, honestly, you'll be unemployed. It increases your problem.
That's true. And because of these transportation constraints, so many people are now looking for remote jobs. You know, jobs that they can do without involving a penny in terms of spending on transportation. Oh, well, thank you so much, Rosemary. Okay, before we let you go, just give us a summary about the National Sewing Championship coming up, the 2025 edition. What is it about? You know, it's an impactful and insightful event. So just give us a summary of what it entails.
The National Sewing Championship is a vocational skills competition. It's a bit different from other vocational skills, because you would say singing is a skill, and then you could talk about, yes, mathematics is also a science, and people come and sit down. This is a very practical competition where the competency of an individual gets assessed. It means I am coming for a competition that I just walk into this hall like both of us now. I have my pack, you have your pack. It's going to test your creativity. It's going to test your knowledge of what you have. It's also going to test how ready for the industry you are, real life experience and real life ability. Again, education is all about functional skills. And when a child enrolls into school in Nigeria, you are expected to have real market-ready functional skills by the time. And so this also addresses the issue of whether graduates have cognitive reasoning, your ability to think, to create all by yourself. So a bit of that is what we are doing through the National Sewing Championship. Like I was telling you, the dress I am wearing was produced by the second winner in 2023, which was the pilot edition. Today, this girl is in Federal University of Technology, Mina, and she's studying some course that has to do with criminology or something like that.
She's still practicing this.
She's practicing this
because right now she must have
in that competition she won an industrial sewing machine and a weaving machine. So she could do this 100% by herself. So a bit of what we are doing is to say that talking about housing, talking about entrepreneurship, and talking about health, that child is likely to have more self-confidence, more less exposure to sexual violence and the rest of them, because she's going to earn an income that keeps her in school. By the way, we should underscore the fact that tertiary education, some people will tell you, is not mandatory, because if you're going into tertiary education, you're already an adult. So a bit of what we are achieving through this competition is make sure that the adults are prepared, they are productive members of their community. But again, it also engages stakeholders, because we are saying part of the challenge we have is that there are deficits of infrastructure within our school. There are no skill centers. The individuals, you don't know them, they are faceless. So now if you want to reward somebody, the likelihood is we all critique some politicians and said, hey, everything they are doing is political in quotes. So you carry 1,000 sewing machines to a community, you hand it to the women leader who looks for the party chairman, and then they bring in a stream of people who don't even need what you are giving to them, and it ends up. But this also helps us identify who are the real target beneficiaries. And so what we do again is to advocate that people could look at strengthening people that have skills as a personal and corporate social responsibility. For this year, registration is ongoing in all the 36 states and FCT. We thank the African International Housing Show for the partnership support we are and speaking of the housing sector, we want to thank Footstool Estate also, because from last week in FCT, we've been doing town hall meetings. The FCT Department of Mass Education organized this. And what's, like you say, I'm just coming from Mabaji. And you get to hear amazing things from the people. How people didn't even know. Somebody asks a particular question which concerns you, and I'll need to pass that to you. And they're asking why There is no carpentry workshop. The guy has no access to carpentry
Okay,
workshop.
just like the sewing.
Exactly. Not even that he wants to do competition yet.
Okay,
He doesn't
okay.
know where he will learn.
Okay.
Now, you will tell me if an average person, and I'm throwing this challenge to the housing sector, please support us in education and support us in skills, because the people you are needing as craftsmen in all of those areas, we're talking about the importance of sewing to all walks of life.
That's true.
In housing, you do a lot of sewing.
Of course.
A lot of even the temporary structures you need in your construction sites, when you are beginning to look for tarpaulin and the rest of them. Auntie, who made them? Who sewed them? To create tents and a whole lot of all that. Because some of these, you know, now we talk about refugee camps. What happens when you take in people there? Most of these things are imported. And so when you talk of the domain of sewing, the particular soft skills you have in sewing are amazing.
So it goes beyond fashion.
It goes beyond fashion. It's garment making. So as a TVET promotional, which is where we're asking everybody to support us, irrespective of your sector, because this child that needs to participate in this competition needs a lot more than that. So, but for this year, the state level registration of contestants will end July 15, just about 2 weeks from now.
Wow,
and in every state on July 15, on July 22nd, all these young people who are registered will be sitting across all the states and the colleges of education, taking these first steps. Then their winners will compete again at geopolitical level. And then the overall finals will meet in Abuja, 17th to 30th. Can we recognize people who are supporting young people in this area? Now, a child who needs to take part in a sewing competition, Auntie will not have time to watch television.
That's true. All right, thank you so much, Rosemary. It was nice having you on the show.
Thank you so much.
All right, viewers, this is where we end this episode. I hope you've learned one or two about the impacts, the health impacts of housing insecurity. It affects our health as well as our income. Many thanks for watching, and do stay tuned to Housing TV Africa for more insightful updates. I am Confidence Ruben. Bye for now.